So now moving on to tarnish and corrosion part 2 video, where we'll start with the types of corrosion. As mentioned earlier, we will move on to each and every. First is your dry corrosion. With regards to dry corrosion, it happens in the absence of an electrolyte or water. So it purely happens in the amount of moisture present only in the air. So this is of minor importance to dentistry because oral cavity is always surrounded by n number of microorganisms and concentration changes in the electrolyte because of these microbes, saliva which is present in the oral cavity. So it is always a concentration difference and the presence of electrolyte which causes corrosion in the oral cavity rather than dry corrosion, which is only of theoretical importance with regards to dentistry. Our interest is always wet corrosion, and that was explained in the previous video. So clinical examples of wet corrosion, as you can see here, the implant abutment junction, it has been corroded, and also the amalgam restoration, you can see pitting type of corrosion. So these examples, why it is shown here is these are the components which tend to corrode in the oral environment. So wet corrosion happens because of either a repeated stress, as in the case of amalgam restoration. So the more negative potential areas will form pits and corrodes easily compared to the positive potential areas. Similarly, in an implant abutment junction, because of microbial invasion or change in the concentration of electrolyte in that particular area will have a more negative potential, and that will act as an anode and deposit the corrosion products and loses ions into the cathode. So the clearer area which is not corroding will act as the cathode, and the area which is being corroded will act as the anode. Next is your concentration cell corrosion, and this type of corrosion is also seen in the oral environment. This occurs because of changes in the oxygen concentration as well as changes in the local electrolyte concentration. As you can see in the first picture, in case of change in the oxygen concentration, one can see that there will be low oxygen at the anode and high oxygen at the cathode. The part of your metal which is having low oxygen concentration and that is in direct contact to water will corrode, and the high oxygen concentration cathode will receive the lost electrons, and because of this basic concentration difference of oxygen, the corrosion actually happens. Similarly, you can see a metal RPD will always have clasps, and in case of food accumulation in the interproximal area, you will have the electrolyte concentration change because of the food accumulation in the interproximal area, and underneath the clasp will act as the anode, and the superficial portion of the clasp will act as the cathode. So underneath your clasp, corrosion will occur because of the negative potential. So this change in the concentration of your saliva as well as the concentration of oxygen, because of which corrosion is happening, is called as concentration cell corrosion. Next is your galvanic corrosion. So this is of special importance in dentistry because galvanic is nothing but the corrosion caused due to two dissimilar metals in direct contact with each other. As you can see in the first picture, because of the direct contact of dissimilar metals, the more negative potential metal will corrode. So whenever you remind that in the oral cavity, your saliva will act as an electrolyte, and when you imagine a gold filling in the upper teeth and amalgam filling in the lower teeth, you see that the amalgam filling will corrode because your gold is always towards more of positive potential compared to that of amalgam, and amalgam will act as the anode and it will corrode, losing the electrons. So this is how your electric pathway is being conducted, and this will be perceived as a shock or a sharp pain by the pulp which is directly connected in the electric path. So you have to avoid dissimilar metals in direct contact in order to reduce this shocking pain in patients. So next is your stress corrosion. As I have mentioned earlier in your amalgam restoration, already deformed areas when exposed to repeated stress, it will generate an anode and cathode, and the deformed area will form an anode and it will corrode, and this corrosion products will proceed further, and tensile force will pull the corroded area more apart, and the stress deepens and results in failure. So you can see this in amalgam restorations as I had shown in the initial picture, and also this will cause failure of an implant because of improper design of the implant abutment junction or microbial invasion and improper occlusion, resulting to direct stress over the corroded areas, and that will cause the implant failure. Next is your crevice corrosion. Crevice corrosion is nothing but pitting type of corrosion, where you can see that in the deepest portion of the pit, the oxygen concentration is little bit less when compared to that of the surface oxygen concentration. So this deepest portion of the pit, which is already existing in a restoration, will act as an anode, and that will lose electrons to the surface, and the surface will act as a cathode, and end result is the deposition of corrosion products. That's why always your restorations have to be highly polished, and elimination of pits is more important in order to avoid this type of pitting corrosion. So there are n number of ways to prevent corrosion, which means that whatever factor is causing, you have to prevent starting from the selection of the material till the final delivery or finishing of the material. With relevance to dentistry, whatever type of protection can be done is, whatever metal we are using, we can passivate the metal by preventing its reaction to the external environment, like addition of chromium, titanium, so that your metal will be passive. And also in cases like galvanic corrosion, you can prevent the galvanic shock by application of cavity varnish or insulators, so that even though some amount of galvanic shock being present in metal restorations, even though if you avoid dissimilar metals also, in any type of metal restoration which is very close to pulp, you can prevent the transfer of electric current to the pulp by insulating it with a layer of varnish. So all these are some examples of prevention of corrosive products with relevance to dentistry. So with this video ends. Thank you for your patient listening.